Greetings everyone, and welcome to another session of Cosmetic Corner. My name is Chris Surek, your moderator, and I'm very excited to have Dr. Jen Walden joining us today. Dr. Walden's in private practice in Austin, Texas, and as you all know, is very actively involved on the national circuit. So Dr. Walden, thanks for joining us today.
Thank you for having me.
We're here to talk about a recent article in ASJ looking at injectables and the conversion of injectable patients into surgical patients. This is out of the Cleveland Clinic, senior author Dr. James E Zins. And Dr. Walden, I'd like to get your impression of the article, and also can you talk to us a little about your practice and how the gateway from injectables to surgical patients functions in your practice?
Sure. This was a great article. It was complementary to a landmark article years ago, about 10 years ago, called the 777 study that found that cosmetic injectable patients would go to practitioners who offered lower prices to try to get them in, and that we as plastic surgeons who are trained with a three-dimensional anatomy of the face should offer those services in order to capture those patients and offer them skilled and safe services. So this Dr. Zins paper showed that those people actually convert to surgery and can provide you with, a back and forth of coming for injectables and non-invasives and ultimately ending up doing a facelift or some type of tummy tuck procedure, whatever that was. That is kind of mirrors how I go in my practice. Basically, we have a med spa which is growing and growing by leaps and bounds as the non-invasive realm grows, and I'm opening another one up in the other side of town starting December 1st. So it's amazing how it almost eclipses the surgical part, right. But it hadn't done that yet. And basically about 30% of my med spa patients, non-invasive injectables, laser patients, end up becoming some type of surgical patient for me. And so that's great. I have a great back and forth with my injector.
Very nice, very nice. Beyond injectables, is there some other device or system that's on the horizon that you think it was a good utilization for you to convert patients from non-invasive to surgery, or a device that every young plastic surgeon getting out of aesthetic practice should look into? Just curious, non-biased, but just your own personal experience.
Well, I mean, I think everyone should look into kind of the holy grail of what we're looking at as plastic surgeons, and that's non-invasive fat reduction and skin tightening. That could be by radiofrequency or another type of laser energy. And basically, those patients really are a catch-all. A lot of them come in and they may want neck tightening, but they're really more of a neck lift candidate. They're not going to get the kind of contour that maybe a 35-year-old might have if they're 70 years old and they have jowls and marionette lines and a heavy waddle or whatever. Also, patients come in often wanting non-invasive fat reduction of the tummy or the thighs, and they're really much better liposuction candidates, and we offer that and tell them why they're not going to be happy with this, repeated procedure over 6 to 8 weeks that costs about the same as liposuction, and those become surgical patients as well. So they really get a good anatomic examination and consultation, and they can go either way, really. But it's the non-invasive fat reduction that I think most young plastic surgeons should really look into and understand and know those devices, and your standard laser, your lasers that can provide hair reduction, skin resurfacing, and skin tightening, that sort of thing.
Excellent, excellent. Well, Dr. Walden, thank you so much for joining us.
And I have one thing. I wanted to show you a new book that was launching at this meeting by Dr. Jerry Lamb and Dr. Chris Surek, sitting here, and I'm promoting it because it matches my dress, and I'm that vain. But basically, it's an amazing book called Facial Volumization, an Anatomic Approach, which shows a step-by-step method of the fat compartments of the face and the nerves and the blood vessels, and overlaid each chapter by chapter till you get from deep to superficial. So I would recommend you go by Tima Publishers and get one.
Well, that's very kind of you. Thank you for saying that. All right, well, everyone, hope you enjoyed it, and we'll see you for the next Cosmetic Corner.
Bye.